Welcome to The Thriving Mama, the podcast that teaches you not just how to survive, but to thrive in motherhood. I'm your host, Dr. Stephanie Davis. So this episode is near and dear to my heart. I'm going to start off by sharing a very embarrassing story with y'all. And we're going to be talking about pelvic floor health, how trauma is stored there. But like I said, I am going to share a very embarrassing story with you first. So after I gave birth to my son, who is my first child, he is currently 11 and a half. I'll give you some context around the birth. It was very hard for me to get him out. I birthed him in a birthing center, and in my brain, I had been thinking that it was going to be easy peasy. And it was not. So they started me off in the big birthing tub, the pool, and it was amazing, but he was just not coming out, and my cervix was not opening. And so they're like, we're going to have to get you out. And I didn't want to get out because the contractions hurt. And then they put me like on a birthing stool, which puts you kind of like in the squatting position, thinking that would help. And that helped a little bit, but didn't completely do the trick either. So then, crying and like stuff happening everywhere. The midwives had me walking up and down the hall, which got me moving a little bit more. And then they actually had me pulling on a rope because that can actually help a little bit more. But it wasn't until they put me on all fours that, my whole pelvis opened up and it was easier to get him out. He finally started moving through the birth. And it's interesting because during the episode, we're going to talk about some of this, like the whys behind it, why it was not actually moving. But the embarrassing part was not that. I feel like that was completely normal, natural. It was difficult, but that wasn't the embarrassing part. That happened afterwards. So after I gave birth and brought my son home, I was not going to the bathroom. Not at all. I wasn't pooping. I did not poop for 10 days. I want to say, actually, it was probably closer to 2 weeks because my in-laws came to see the baby, to help out, and I hadn't pooped. And I also had a hard time initiating peeing after I gave birth too. So those were hints that I had some pelvic floor trauma. But what happened was so embarrassing. So the midwives called and they were checking in on me and they were like, you have to poop. They're like, this is just not normal. It's not good. You need to poop. Otherwise you're going to have to come in or you're going to have to go to the emergency room. And so I made my husband, his mom was a nurse. And so they went to the store and they got some enemas and some other things to help me. And I was so embarrassed and all of the things that, I wouldn't let anyone help me. And so I sat there crying my eyes out on the bathroom floor for a good 2 to 3 hours before I would let anyone come in and help me. And it was horrible. Like, just not to get too graphic, the bathroom was not super clean at the time because I kept on trying to put in the enema and then I would take it out. There was all sorts of not good things happen, not good stuff. So then finally, I let my husband come in because he kept on knocking on the door and he was like, can I help you? Can I help you? And I wouldn't let anyone help you, which, as you have heard in a couple of other episodes, that used to be a pattern of mine, not letting people help me. And so I let him in and I finally went and I was still crying on the toilet after I finally went because I made a mess and I was just so utterly embarrassed. And so at the time, I was absolutely mortified and traumatized, but now I can look back on it and laugh and, realize it was a growing experience and a learning experience. But what was interesting was, once all of that had settled, I still was not 100%, like with the stools and with going to the bathroom for pee. I was kidding around and I called myself the dribble queen because I could not hold I'd go to the bathroom and then I'd stand up and, urine would drip out, or if I walked, if I coughed, if I sneezed, if I laughed, all of the things that happened postpartum, I would, urine would come out. So that was an issue. I ended up getting referred for some pelvic floor work, and I also had some Maya abdominal massage done, which all were amazing and helped me out. I got back to normal, and I did not let that happen with baby number 2, who I had her 4.5 years later. And I was very mindful going into that pregnancy, I should say pregnancy first, but also birth. I didn't let that happen. And then after I delivered my daughter, I got back on, working on my pelvic floor and my core immediately. And it's a really, really important thing to do. And we don't talk about it enough. So in today's episode, I'll be diving deeply into all things pelvic floor with my very good friend and pelvic floor therapist, Aleta Wagner. She and I have had so many conversations, and today we're going to let you in behind the scenes from each of our perspectives and experience, because even though I don't do manual work with people anymore, I still deal with a lot of pelvic floor trauma with women, and birth trauma, and just the trauma in general. When I see people in practice, when we're doing the trauma work, almost all, I would say 75, 80% of the women hold their trauma from their diaphragm to their pelvis. And that just becomes a big block for them. And so I work on it there. And so some of the main things we're going to talk about today, three of the big points, are going to be your understanding of the pelvic floor. What are the pelvic floor muscles and how do they work? The top pelvic floor issues across life for women. So starting with the teenage years, moving through pregnancy and postpartum, even just women who have incontinence issues and things of that nature. And then the perimenopausal and menopausal years. Those can also be major times when pelvic floor issues rear their head. And the last one is going to be why kind of like tight hips and tight pelvic floor muscles are a red flag for anxiety and trauma. This is something that isn't spoken a lot about, but that when I'm actually doing an intake on patients, I always ask about this. Do you have tight hips? Do you have a tight lower back? There are things that I'm asking to screen for, because I find that so many people, I'd say mostly women, are holding anxiety and trauma in these areas, as I mentioned before. So that is what we're going to be diving into today. Aleta Wagner is a pelvic health occupational therapist, prenatal and postpartum exercise specialist, and founder of Mountain Mama Pelvic Health in Monument, Colorado. She supports women experiencing symptoms of pelvic floor and core dysfunction through transitional times such as pregnancy, postpartum, and menopause, using holistic and functional client-centered therapies that are truly individualized. She is passionate about normalizing conversations about pelvic and sexual health and educating and empowering women in our community. Want to chat and get more personalized support? I'm offering podcast listeners a free 20-minute Thriving Mama check-in, where we'll evaluate your physical, mental, and emotional health and provide useful resources to help you on your journey. You will find that link in the show notes. Well, thank you so much for being here, Aleta. I'm so excited to interview you, because this has been a long time coming. We've talked about it a lot behind the scenes, and we haven't got it going, and finally we did. So I'm super excited to have you here, because this is such an important topic.
Yes. Thank you so much for having me. I'm really excited to be talking about it today.
I know. Before we hopped on the recording, we were talking about the importance of pelvic floor and core strength for lifelong health. And it's something that it's recently come, people have become more aware of it, but they're not talking about, the whole picture. So we're going to dive into that today so people can really, really understand that. So like we said, talking about the pelvic floor, and I feel like it's, they're more like elusive muscles that no one has really, really talked about until just the last couple of years. I mean, I want to say in my world, I found out about them after I had my first kiddo when I explained that in the intro, but it still hadn't gained as much traction. I think in the world of people who do physical body work, it had always been there. And women who specialize in like Maya abdominal massage and things like that, they knew about it, but the greater world did not. So what I would love for you to do is to start out by explaining to the listeners exactly which muscles these are and what they primarily do.
Yeah. So if you want to think about your pelvic floor as like a sling or a hammock of muscles, and it attaches to the posterior pelvis. So just bring up I love this little guy. So we are seeing attachments to the tailbone and the posterior pelvis here, and they wrap all the way around the pelvis. So that pelvic bowl on both sides wrap all the way around to the front of the pelvis here. And essentially we have 3 layers to the pelvic floor. The first layer is an external layer, or a layer that can be accessed from the outside in the vulva area. And then the second and third layers are actually internal. So if you take this guy again, it would be internal. These muscles here would be accessed internally, the second and third layer. And then the first layer, like I said, is on the outside. And the primary functions are that pelvic stability. So kind of helping keep the hips and the pelvis stable to support the internal organs of the body. So I'm thinking about just all of the uterus and bladder and the rectum and just the organs that are sitting inside the body. And then also we think about sexual pleasure. So they're there for helping with sexual pleasure. And in women, that is hugely important. And not a lot of women realize that their pelvic floor has such a lot to do with sexual pleasure. And then thinking about the continence of your bowel and continence of your bladder. And so those are the essential functions. And then you can add a fifth one for women, which is delivery. If you're having a vaginal delivery, we think about just the ability of the pelvic floor to relax and lengthen in order for baby to pass through the vaginal canal.
So can you also give the names of some of the more, I would say, common muscles that people would be getting worked on when they come to see, somebody for pelvic floor work?
Yeah. So I love to use this again. And I don't know if you can read all the names here, but we have the obturator internus is actually a huge muscle that attaches on the hips. And so that kind of comes in. Piriformis, so that usually we don't think of that as a pelvic floor muscle, but it is coming in through the sides of the pelvic floor. And then our deeper pelvic floor muscles, we have the pubococcygeus and the puborectalis, which are really important with continence because they are the ones that relax to allow us to pass through bladder and pass through the bowels. And so if those ones are the longer muscles kind of on the sides, and if we're not able to access those or lengthen and relax those, then they can stay tight and cause issues like leaking or issues with bowel leakage or smearing. I don't know if that's something that's come up with any of your clients, but that fecal smearing we see. We like these muscles to be able to contract, but we also want them to be able to relax in order for us to have more coordination of our pelvic floor muscles to be able to function properly.
Yeah, it's super interesting. I learned something the other day from another pelvic floor therapist that I know. And she said that those, the muscles you were speaking to regarding continence, she said when you're peeing, you're technically not supposed to be pushing. You're supposed to be kind of letting those muscles relax and like just kind of letting the urine flow out naturally, which was a mind blowing for me because I feel like, and not that I push hard, but I notice sometimes I'm pushing. So now I'm very mindful of that. It was like that one blew my mind. And then when you mentioned the smearing, can you speak to that a little bit? Because I don't think everybody knows what that is.
Yeah. So typically what I see with clients with fecal smearing is that they're either wiping a lot after having a bowel movement. It just feels like it's never ending, or they're finding some poop on their undies later on in the day after they've had a bowel movement, wiped, thought everything was good. And then later on, they're like, oh, when did that happen? Because they didn't feel anything happening. And so what we're finding is that a lot of women hold a lot of tension in the pelvic floor, in the posterior pelvic floor. So thinking just about here's the rectum here, or this is where the rectum goes. So thinking about just kind of squeezing all of these muscles here and thinking about if you're standing and you're clenching your glutes, you're constantly holding tension in those muscles. And so when you're trying to have a bowel movement, trying to relax all those muscles and we're still holding tension, then we might be getting a little bit of fecal matter just kind of sitting inside of the rectum. And then later on, when you've relaxed, then that can come out a little bit. And so it's just one of those things that you want to be able to fully relax your pelvic floor to be able to have a bowel movement or to urinate, like you were saying, is if you're pushing out your pee, then you're not allowing the pelvic floor to fully relax. It's not doing its job. You're trying to do the job for it. And so you want to make sure that you're letting that relax. And sometimes I find that women will get up after wiping, wash their hands and be like, I need to go pee again because there's a little bit of urine left in between. And so once they allow the pelvic floor to totally relax, they're finding like, oh, I can go a little bit more. So I often will recommend sit on the toilet for an extra 60 seconds, take a couple deep breaths, see if any more urine comes out. And then if it does, great. Then you've just had we call it double voiding. So you've just had that double void and that's totally safe and okay for your pelvic floor. I actually recommend it a lot. And then you can get up and move on with your day.
Like I said earlier on in the intro, I learned so much about the pelvic floor because obviously you and I both learned this stuff in school, right? But so much of it, like, the rubber doesn't really meet the road, so to speak, until you experience something yourself. And I had, like, after the birth of my son, I had horrible pelvic floor dysfunction that I went into at the beginning. And yeah, I was constipated for almost 2 weeks. And then I also was having difficulty peeing. So I felt after the birth of my son, it was like learning how to use those muscles all over again. And something that I found really helpful, that's super weird. This is kind of weird, but it worked for me because I realized like I really needed to relax. I was holding so much tension and the birth of my son was not the easiest. I had him at a birthing center, that part was absolutely amazing. And thankfully I had a team of like amazing midwives who truthfully, I like literally as I was leaving the center with the baby, I was crying because I was like, if you guys had not been here, I wouldn't have been able to do it. I would not have been able to do it because like he wouldn't come out. He just did not want to come out. And I'm sure it was partially because my pelvic floor would not relax, but it was like they had to put me in, like they had me in the tub. He wouldn't come out in the tub. So then they put me on a ball and a stool and they had me, using the rope and all of the things to try to get him out. And I feel like that was I think it was, apparently traumatic for my body because then my body like just tightened up afterwards and didn't want to do anything, including normal bodily functions. And so I realized after I went through my very embarrassing moments with my husband and my in-laws, they had to help me. They had to help me a lot. And it was really interesting because I realized that if I calmed myself down, if I went into the bathroom, shut the door and made it completely dark, I could literally feel this wave of calmness go through my body. And I could actually have pass a bowel movement and the urine would come out easier. And I literally use that to this day. If I go into the bathroom and I feel tense, I shut off the light. So there's like no stimulation. And I just I relax myself to go. That's what I found worked for me. It was crazy.
That's wonderful. It's a great tip. I actually will keep that one in my back pocket.
You want to know what clients. I honestly think part of it is the lack of all the stimulation coming at you, because I make sure that I would go into a bathroom that was far away from noise. So no noise, no light stimulation. I mean, really all there is like you in the darkness on the toilet. So, it was really interesting. So that's kind of what I used. And to this day, sometimes I will still use that if I need to.
I think that's great. I also think that even having young children who you're in the bathroom, you shut the door, mommy's in the bathroom. And it's like, Mom, the fingers under the door, the knocking, the trying to open the door. And how are we supposed to relax our pelvic floor if that's going on? So I always tell my kids, Mommy's going to the bathroom. Please give me some room. And most of the time they do. But yes, just to take that step for yourself, because if you're trying to pee in 20 seconds and be out the door, I'm not going to be surprised if you tell me, yeah, I dribble a little bit afterwards, because you're not allowing your pelvic floor to relax so that you can fully evacuate your bladder.
Exactly. I know. For me, I've got the kids who try to come in and a dog who like literally tries to follow me around everywhere. I could hear she's chirping right now all over the house because she sees things going on. But yeah, she'll try to come in with me too, especially if I've been out of the house and I like run in the door and try to go to the bathroom. She'll try to come in there with me. I'm like, nope, you're not coming in. That's so funny. All of the things that can happen, right? Speaking of all of the things, life transitions. You had mentioned that in your bio, and I love that because, anyone who listens to the podcast or follows me know that life transitions are a topic that's very near and dear to my heart. because it's something that unless you're very mindful about what's happening, I'd say mindful and intentional, we can get into trouble because that's when, we're going through these changes. And if we're not aware and intentional, those changes kind of happen to us. And, if you're just automatically going through your day and your life, things will happen. And then you wake up, 6 months down the road, a year down the road, and for women who are older, even like a decade down the road. And you're like, what happened? What happened to me? So I would love for you to touch on kind of like the main pelvic floor and core dysfunctions that happen at transitional times in a woman's life, such as like the teen years and pregnancy and postpartum and menopause.
Yeah. So I find that when we're looking at teenagers or young women, I work with women only, so I really more speak to that, but could happen with men as well. But I find that I'm discussing more with the teens and the women, but we're finding just tight pelvic floor. And so we have athletes that are track runners. We have athletes that are tumblers, cheerleaders. They do trampolining, anything that's heavy impact, just a lot of high impact on the body and the pelvic floor. And so if they're having any pain, if they're having any leaking, if they're having any, just the pelvic plane, like sometimes it's inserting a tampon, or sometimes the tampon won't stay in because their pelvic floor muscles, they've been holding so tight that the pelvic floor muscles are like, nope, I can't hold on anymore. And so we're finding sometimes tampons are coming out. And so it's just really looking at what's going on in their system. Is it stress that's making them do this? Is this that they're holding things so tightly because they don't want to leak, so they're just continually squeezing? Is it something where we need to work on breath work to help them to relax the pelvic floor? Usually, yes. Breath work is number one with all my clients, I would say. And that's across the lifespan. And so just looking at what are these issues with these teens? I know that sometimes it's the core is not working. The core is not firing effectively. So we're having this pressure issue. So when we talk about the pelvic floor is kind of like the floor of this core system, and the diaphragm is at the top. And so when we're breathing, every breath is a diaphragmatic breath, but sometimes people breathe really high into the chest. Sometimes people breathe really far low out into the belly. And so we're not managing that pressure well. And so if we're an athlete, even if we're not an athlete, I've seen it in singers. I've seen it just in, general population. If we're not breathing properly and functioning to where our pelvic floor is moving well with the diaphragm and getting the breath in the right place, the ribs are coming out, then we're going to find that there's pelvic floor issues, whether we notice them as a teen or we don't notice them until later on in life. That's a dysfunction that is happening because we're not breathing properly or we're not managing the tension in the pelvic floor. And so I'm finding that, women who are getting pregnant and trying to push out a baby, right? Say, tell us to hold our breath and push. They're having trouble relaxing the pelvic floor. And so we're getting a lot more vaginal tearing. We're getting a lot more muscles that are over lengthening. And then it's hard to bring those muscles back in after birth. So we're getting a lot more of the leaking after birth. We're getting a lot more of just that feeling of, I can't feel anything in my pelvic floor. I try to do a pelvic floor contraction and nothing's happening. And, yes, some of that is typical after birth. And I do see that a lot, but there's a lot that can be done during those late pregnancy stages that we're getting to, is working on breath, working on lengthening, working on being able to relax pelvic floor to let the uterus push the baby out, not try to push it out with the pelvic floor. And just going back to when you said you sometimes are trying to push your pee out, I think women think I have to push my baby out. And that's really not the case. If things are functioning properly, then you should be able to breathe your baby out and let the body do its job. The body knows what to do, and just let the muscles work and really relaxing. And then I find, postpartum, like we were talking about, we do get a lot of that. Just some OBs, like my OB would tell me, your pelvic floor is weak and you need to go work on strengthening. And so then I go see a pelvic floor therapist, before I was doing pelvic floor therapy. And she said, you need to do your Kegel exercises. And that is not what I needed to do. My pelvic floor was already so tight, but it could be tight and weak at the same time. And so I had to kind of go in a deep dive and figure that out for myself. But all that to be said, working on lengthening again. So if you think about just holding tension in a muscle, and I like to think about it as like a bicep contraction. So if we're holding this bicep like this all day long, we're not going to be able to reach out for something when we need it. So if we're holding our pelvic floor all day long, it's not going to be able to lengthen when we need it. Like when we're sneezing, coughing, laughing, jumping, we want to have that that rebound effect where the pelvic floor can come down and then come back up. And so as that continues, we get into perimenopause, postmenopause, then you're starting to add hormone changes. You're starting to add atrophy. You're starting to add just overall strength issue. It's just not happening. We're not getting the same amount of strength and length to the muscles that we want. And so just finding as these women are coming in to see me that it's things that have been maybe a problem since they were a teenager and just didn't know it. Or maybe it was a problem since their first birth, or maybe it was their second birth, or maybe they had a C-section. And so that changed the whole pressure inside their core again, because we're taking just a different angle at things. And so if we have that scar across the belly, the low abdomen for the C-section, if we have scar tissue, that's 6 layers of abdominal tissue that they've cut through. And if things are not moving, then how are we going to breathe? How is the pelvic floor going to be moving? And so we have to look at, it's not just, okay, you're leaking after birth. Okay, so this is what we need to do with it. No, it's looking at a client individually and seeing, okay, what positions were you laboring in? What positions did you give birth in? Did you have a C-section? And how is your scar moving? Oh, it's not moving. Okay, let's look at that. Or did you have a tear or an episiotomy and then your perineal scar is not moving? So you can't expect your pelvic floor to be working around all of these things, these fascial connections that are just holding on. You can't expect to have that full movement of the pelvic floor with that.
There's so many things we could unpack for like hours and days on what you just said, which is so funny. But you're right.
I know. And I get so fired up too.
On so many of those things. And it's funny. One thing that when you were talking about just like letting the uterus push out the baby, I have said that to my patients before. I'm like, in nature, look at every other mammal or animal in the animal kingdom. Their babies, they just relax and the uterus pushes the baby out. We're the only ones who like do all of these like, kind of physical gymnastics to get the baby out. It's really, it's crazy. Yeah.
It's not women didn't innately do that.
No, we did not. No. No. And that's another topic in and of itself, right?
That's another topic for another day.
Oh yeah. Yeah. We did not do that. And, I understand that people are in all different situations, but I just, the way, laying in a bed, hooked up to machines and the position that you give birth in a hospital is just not ideal for giving birth, right? Squatting is way more ideal for birth, right? There's squatting and, even there's other, like I said, with the midwives, they were so helpful in putting me in those positions that would naturally facilitate the baby coming out. So yeah, that was really, really, really helpful. And it's another thing you said that made me think back to when I had my major aha moment about the whole pelvic floor issue was when you said the tampon, might fall out. I had that happen to me. I was at my aunt and uncle's. It was my uncle's brother's house and they built a beautiful new house. We went to look at it and I was in my early 20s and we were walking upstairs. Like I remembered vividly because I was so mortified and my tampon fell out and I can see like all of the things. So that happened. And then I don't think I started having any leaking issues in a big way until I got pregnant. But then it was like the pregnancy and then all of the stuff that happened during, the pregnancy. I did tear, even though I did a bunch of like my midwives had me like doing like stretching of the vagina and like exercises and all sorts of things to just try to prepare the vagina for birth. Yeah, I still had tearing and there was so many things that happened. And like you were talking about like the scars and I don't think I felt like it was probably 3 months, at least 3 months until after the birth of my first kiddo that I felt like my pelvic floor was like functioning well. Like again, it was a while. And like you said, like you can't really feel it because there was so much trauma down there so much trauma that it is hard to feel what's going on. So in those types of situations, when a woman's struggling to like feel her pelvic floor muscles or like recovering in that like early postpartum phase, what do you typically do with them?
Yeah. So when we're immediately postpartum, I wouldn't say like right, the minute you give birth, but within a couple of days, I highly recommend, trying to access your lower abdominals. And we really do a lot of that in our labor prep is just trying to really feel, what do your lower abdominals feel like? And I do that throughout, with most of my clients, but especially in pregnancy, if we're doing labor prep, is really focus on, okay, let's get breathing into the ribs in the back. Let's get some great, control of your lower abs as much as you can, as far as you can into your pregnancy, because it's easier to feel those after birth when you've accessed them during your pregnancy. Everything's been stretched out and lengthened. And so it's really just being more mindful. So with my, postpartum clients, and even with clients who are, 6, 10, 20 years postpartum, I kind of do a similar thing, but we use different tools. We can use our hand. We can use a rolled towel. Sometimes I use a different ball. So I have squishy ball and I have more firm balls, but we sit on those in a certain way and start breathing, just breathing and seeing, do you feel anything happening on that towel or on that ball that you're sitting on, or a pillow, whatever it is, a blanket, whatever it is that you have. If you're using your hand, great, use your hand. With my immediately postpartum, most of them are like, nope, I'm not putting my hands down there. Everything is scary. So we do more of like the towel. And this is fully clothed. You're not, naked at all with this, but fully clothed, but wearing pants that you could essentially feel things through. So not jeans or anything, but something that you could feel things through, and just really feeling, what does your pelvic floor feel like with just your breath? Okay. So if you can't feel it with your breath, then let's start accessing some things. Can you feel your tailbone? So most people, they know what it feels like to hold in a fart, right? Like you really know how to access those posterior glutes. Okay. Let's start there. So access your posterior glutes, and then let's try to move things forward. And so if we can access that perineum and really feel that middle of the perineum moving, okay, great. Then let's bring things forward. And I find it's hardest for women to feel their clitoris move. We want 3 functions essentially with our pelvic floor. When we're doing a pelvic floor contraction, we want the clitoris to nod, we want the perineum to lift, and we want the anus to kind of wink, right? And so it's just those 3 movements kind of happening all together, but you can kind of isolate that front, that anterior pelvic floor and the posterior pelvic floor, because there's different muscles that function. It's not just one muscle that comes up. It's lots of muscles and fascial attachments. And so you kind of can isolate those things. So I do try to have clients see, can you feel your posterior pelvic floor? Great. Let's start seeing, can we move it forward? And sometimes it's leaning forward on whatever they're sitting on. Sometimes it's moving tissue away so they can see with a mirror if they're open to looking at their vulva area, which a lot of women are not. And that's okay too. But just accessing and finding, but starting with the breath. And then let's do a couple different things. So I give different cues to clients. Sometimes it's, can you pick up this blueberry? Sometimes it's, can you flatten this handkerchief? Just thinking about different ways, different visualizations for people. Sometimes they're more of a tactile person and they really need to feel with their hand, or that kinesthetic awareness, feel with their hand. Sometimes it's, I just need to close my eyes. And like you said, turn off all the lights, no noise, nothing, and just really kind of breathe and sit with my body. And women who are not familiar with their bodies and have never done this before, it's a lot harder to access their pelvic floor. Women who kind of know what their body feels like and can really have that more, they're closer with that interoception, right? They really can know, okay, I know how this feels in my body. It's so much easier to access their pelvic floor. And it really just depends on the client. And I will meet the client where they're at and say, okay, we're not feeling it today. Okay, here's some things to work on. And most of the time it's, let's work on your breath and really feeling what your breath feels like in your body. Try to feel your breath in your ribs. Try to feel your breath in your back. Try not to be lifting up in the chest and not pushing out with your belly, not bulging out in your pelvic floor. I don't ever want clients really bulging out anywhere, but just feeling, what does that feel like to just breathe? And if you do feel pressure in the vulva area when you're breathing, that's a red flag. And I want to look at that further.
Yeah, exactly. Yeah, that's all good stuff. And one thing that I did want to clarify for anyone who doesn't understand what interoception is, that I always try to make sure that we understand all of the terminology. So interoception is understanding the sensations that happen internally in your body and your ability to, a lot of times it's consciously control it. Sometimes it's not. Sometimes when I'm working with people, if you are feeling stuff happen in your, in your stomach, if you're feeling gassy, or if you feel like the sensation of burning from acid, especially that happens a lot during later stages of pregnancy, right? The acid reflux. Those would be, sensations like if you're perceiving that, that's interoception. So just so people understand that. But you brought up something big, which I think is going to change the tides on our conversation to segue more into some of the big issues. So one was, like you said, there's so many women who struggle to like want to look at their body, or even I feel like so many women, it's like they're cut off right here. It's like the head is separate and then the body is its own entity. And that is so harmful from the standpoint of it's like a societal thing, right? It's like women have been taught, especially in a lot of the Western cultures, the shame around their body, right? Like the sexuality is shamed. Their bodies are shamed, right? And so that gets into the subconscious mind. And that's where these women you're like, I don't want to look at my body. And they're almost afraid of it. And that like breaks my heart and makes me so sad, because that doesn't typically happen to men, but it's just sad that we're in a place that women are feeling like this and they're made to feel like this. And all of the, just conscious and subconscious things that happen because of that. And so that made me want to get into the trauma aspect, because you and I've had, so many conversations about like women holding trauma in their bodies. And particularly, I find this in practice, and I know you find this in practice too, in their pelvic floor and the psoas muscle. And like in the kind of the emotional realm, we often refer to the psoas muscle as the muscle of soul, or the emotional muscle, because what's super interesting is that muscle, it goes up, and the kidneys and your adrenal glands are nestled right on top of that. And so they're literally embedded in the space where women tend to hold their trauma. And if you think about it, it's really interesting, because the kidneys are responsible for filtering out toxins, and the adrenal glands are what control your fight, flight, or freeze. I always tell my patients, I'm like, think about that. Think about that, because then like I especially find it starts off in teen years. It could start off with something like shame or a bad sexual experience, or there's so many causes, but then that initiates then, and then often carries on throughout their life until they're made aware of it. I would love to hear how you see that present in practice.
Yeah. So a lot of times if I have a client who's got pain with sex, pelvic pain, a lot of times there is a trauma piece that's involved with it, whether it is a subconscious trauma, like maybe it was a birth that didn't go as planned, or maybe it was an actual physical trauma or a sexual trauma in the past. And I find that it's not just teens. Sometimes it's all the way back in a childhood, and it's a repressed memory that they're not even aware of, because they just don't know, or they've forgotten, or, it's just been something that they were so young, they don't remember, and it was never talked about. Right. But it's still held in their bodies. And sometimes it's something that comes out in a counseling session. Sometimes it's something that comes out when they're talking with their family. Sometimes it comes out when they're trying to be intimate with their partner. But sometimes it comes out, when they're sitting in my office or on my table as I'm looking at things, or working on, their abdomen, or looking at the rib cage, and they're like, "Ooh, that's really tender right there." And so we just start diving in and saying, okay, what are the reasons that you might be having tenderness in your psoas muscle, right? Are you sitting all day? Okay. You're not sitting all day. Okay. I'm looking at just what are they doing and how much movement are they getting in their day? So just really looking at just the active pieces, but also looking at what happened in your past, or is this pelvic pain been something that's always been there? Or is it something that has just happened maybe since a birth? So really looking at that history and looking at the client's ability to talk about it. So a lot of times it's something that, I'm an occupational therapist, so we kind of talk about everything. Nothing's off the table. So we just kind of get in there, but we really like to look at, it's not just what's happening in the muscles and the joints. It's looking at what is happening in that social emotional aspect with you. And if you are holding on to trauma, how is that manifesting in your day to day? Is that why your pelvic floor is tight? Because you're holding on to trauma? Is that why you are having pain with sex? Because you're holding on to trauma? Is that why you're afraid to give birth? Because you're holding on to trauma, right? So looking at it is a very individualized, and you kind of have to take it case by case, but really it also comes back to breath, breathing, looking at your client. How is their vasovagal response doing whenever you're talking to them or working with them? Are they coming out of their body and disengaging when I'm trying to do a pelvic exam, right? And at that point, you have to take yourself out of there and bring them back into their body. Because if you are dissociating with your body, you need to be present in your body. And I never want a client to feel like they have to check out when they come in my office. So yeah, just really taking a look at those things.
Yeah, it's really, really interesting. I don't think people realize. So I know most of my audience knows that my doctoral training is as a chiropractor, but I originally did, I did it to become a, functional medicine practitioner, because back then you had to have a terminal degree, like you had to be an MD, a DC, an ND, all of those things. Now it's much more widely available, but 20 years ago it wasn't. And so, so I did that. And I don't think people really grasp how, like, when you're working with somebody, like that hands-on work, how intimate that is. It really, like, I can't tell you the number of people that I've had, cry on the table. And I used to think, back before I had all of my training in trauma and emotions and the subconscious work, I used to think, why is this person crying? They're crying for no reason. No, they're crying because there usually is some kind of trauma there, whether they're conscious of it or not. And so one thing that I also wanted to clarify for people, and if you've listened to episode number 5, is where I get deeply into trauma and where people can understand the differences of trauma, why some people perceive certain things to be trauma and certain people don't. But one thing that we talk about is suppression versus repression. Suppression, when you suppress an emotion or a memory, that's you consciously doing it. Repression is something that you and I both probably see quite a bit too, where the person, their body, their mind has hidden something to keep you from the pain, right? To keep you from reliving that. And so that can also surface in many, especially in what you mentioned, in people being out of their body. I find that women with, say they had some kind of sexual trauma when they were very, very young, especially, I find that it happens more in the, I hate to even say this out loud, but a baby to a young toddler, you find that those are often repressed memories. And that's when we're getting into the subconscious work, it's interesting because a lot of times with those folks, I have to do a little bit more digging because of the fact that your mind will try to shield you and protect you from it. And so that's sometimes we have to be a little more, just nuanced and gentle and work with your body. One thing that I'm constantly asking when we're doing that subconscious work is your body ready to address this? Or is your body ready to let this go? And if they're not, I'm not going to push it, because for me, it's all about creating a safe space and working with the body, not trying to push anything or working against the body, which is really interesting. And it was, you had mentioned the emotional aspect right at the end of what you were saying. And I think it's fascinating because the research actually shows that there is an emotional link between, the mind and the body. But specifically between the hips, there are several research studies that show this link. And I'm going to put those links in the show notes just so you all can see. There was a 2019 study done that correlated certain emotions that are associated with specific areas of the body. And so it's interesting because that was also found to be universal across cultures. And I thought that was fascinating too, because a lot of times there's nuances between cultures, but it was universal. So I thought that was really cool. And then, there were a couple of other similar ones, but something that I always tell people to look into is Candace Pert's groundbreaking work. Are you familiar with Candace Pert and Molecules of Emotion, her book?
No.
Okay. So you might want to check that out too. So she wrote a book.
Put that on my list.
On your reading list, right? So she wrote a book called Molecules of Emotion, right? And what her initial discovery was that there are neuropeptides, which are basically small proteins in your body that activate circuits linked to emotions. And one of her most famous quotes is, "Your body is your subconscious mind," and that the physical body can change depending upon what we're feeling. She's the one who did all of the research that pioneered this. And her research suggests that emotions are electrochemical signals that carry the emotional messages throughout the body. And then they are expressed, experienced, and stored within the body and the mind. And so I also will, I'm going to put some links to the studies, but there was actually a 2021 study that was called, it's like I think the biomolecular basis of cellular consciousness that reinforced her work. And it concluded that it says eukaryotic cells, but eukaryotic cells are just, the cells that make up, plants, animals, and fungi, essentially. They are that confirmed that they are cognitive and intentional. So basically that study was showing like each cell has a little kind of subcellular nanobrain. And that's kind of what facilitates all of this. But basically what happened was this study her work led to the fact that we know that emotions and trauma are stored in different parts of your body. And that's the crux of the work that I do. Is the fact, we go after that. I always tell people, a lot of people do come to me saying, hey, I want to work on X, Y, or Z. You had mentioned the birth trauma. I work a lot with birth trauma and anxiety. A lot of women having anxiety around birth, but a lot of women say, I don't know what it is, but I know something's there. And that's what we go after. We go after the body feeling because that's where it's stored. And it's I find all of this stuff so fascinating. And I'm assuming you see this stuff in practice too. So what do you, I said, a lot of women say, I know there's something there, but I don't know what it is, or I feel stuck. So there's all the terms, you hear certain things that what the person's getting at, right? After you've been practicing for a while. So I'd love for you to share some of your experience around that.
Yeah. I mean, I tend to do more of a functional movement based approach. And so I'm not just looking at pelvic floor muscles. I'm looking at how's your whole body functioning? How's your whole body moving? So if we're saying that we're feeling stuck, okay, where are we stuck? Where's it sticky? Does it feel sticky when you're trying to internally rotate your right hip, but your left hip, you can internally rotate all day and it's just fine. And a lot of that goes back to what we're talking about, the psoas muscle. The psoas gets a bad rap.
I know it does. It does. Psoas and piriformis.
It really does.
Those two.
Yes, they do. They get a bad rap. But part of their problem is they're getting stuck because we're not able to move through that trauma, that emotion, whatever it is that's keeping us sticky, right? We can do exercises and stretches all day and we're still not getting there. Then there's some deeper component that has to be looked at. And so I even, my pelvic exams are optional. I don't do pelvic exams with all my clients, but when I'm finding that if we're doing body work externally and we're not making headway, then I say, we might want to see what's going on internally. And are we holding on to something internally and really seeing how can we access this? And so, you can do some visceral work externally and access the psoas, but you can't always get to what you need. And so it's sometimes just getting internal and say, okay, in this layer 2 muscle on the left side posterior, you're stuck there. And sometimes it's, just a light palpation and we get tears. And you have to think okay, is there tears because I'm hurting you? No. Okay. That's because we're holding tension there. We're holding our emotions there, right? It's really just once we release that, get the emotions going through, just cry. It's okay. I'm not going to judge you. I want those emotions to come out because then we can start working through it and then seeing, okay, now what are we feeling in the body? And just really getting into the root of the issue. Like you said, you have to find that root cause. It's not just, okay, my psoas is tight and I'm just going to stretch it and that's going to be the end of it. No, because if you don't get to that root cause, it's just going to keep getting stuck over and over. And so just kind of finding out what is the best for that client.
Yeah, it's really, really interesting. Recently had an experience. I think I may have shared this with you, but I'm not 100% certain. So, I think something that happens when you're a person who does emotional and trauma work with people, you know how to do it to yourself. And I'll be the first person to say that I prefer to actually have somebody do it with me and hold the space for me. And that became super evident when I went to that retreat, which I've talked about multiple times on the podcast. I've interviewed friends who were there with me on their experiences too. And it was interesting because like supremely clear that I need to have people hold space for me, because I thought I literally went into that retreat thinking, oh, I'm good. I do all this work. My body's in a good place, all these things. And I was there and I literally, like you talked about being disconnected from your body. It happened to me on the second day where I literally felt like out of body experience. I was having really bad headaches, all the things that kind of happen when you're in those situations. And I like I had explained, in some of the podcasts, I had been holding on to, trauma surrounding my miscarriages. And then when I actually, now that it's interesting how trauma and awareness work, because I thought I had worked through all of it. And now certain things are coming back up and I'm working through those as they come up. But what was like the big needle mover for me was the trauma surrounding my miscarriages, my husband resolving those issues with him. Some of it was resolving the issues with like my attitude and how I viewed my body, because I think somewhere I was not conscious, but subconsciously I was thinking, my body's failing me. My body's not good enough, all of these things. And I was, so I was literally holding that. It was interesting because one of the, the facilitators there was like, your solar plexus chakra is blocked. And she was straight up right, because like when I'm doing breath work, or when I was doing breath work and when I was doing like literally like I can move, I feel like I'm good at moving energy through my body. I would always get stuck right below my rib cage, right where the diaphragm's sitting. And so and that's also when I was doing my trauma work, when I would go after my own body sensations, more than half the time I would be pointing to that area. And I never knew why. And I feel like I chipped away at it over time, but I never fully got to it until I was there. And like I worked with her and I had like this big emotional purge. What was fascinating about that? So it didn't happen all at one time. It happened over a period of 3 weeks. And it was like, I kind of always say, like, I felt like I was in a loop, like a Groundhog's Day loop, where it was like every Saturday I would get this feeling that would come over me, and I would just go into the bedroom or bathtub and cry a lot. And that actually facilitated conversations with my husband and I. And then finally, I literally felt it all release. Like I was like, oh, I can belly breathe again. I couldn't belly breathe. Yeah, I was like, it was tight. Like I couldn't belly breathe. I could contract, like you were talking about, like the winking, the lifting, all of that stuff. I could do all of that, but it was like it was disconnected. It was crazy. So now I feel like everything flows. But what was really interesting is my libido was completely shot for basically after all of that stuff happened. I had my daughter, but I feel like even after I had her, and she just turned 7 last week, I felt like that this entire time my libido never came back. I obviously know it was like a subconscious mechanism, but after I did all of this, my libido came back, and I had attributed it to perimenopause and the hormone changes. And it was fascinating because once I cleared out all of this, it was insane. My libido came back full force, and it was funny. And I confirmed this I had a patient I was working with, and she sent me a message yesterday, and she's like, I don't know what's going on. She's like, I did 2 sessions with her, one 2 weeks ago and one the week before that. And she's like, I don't know what's going on. She's like, I'm super horny. She's like, I can't stop thinking about sex. I'm like, oh, I just went through that. You want to know what's happening? It'll wear off in about 2 or 3 weeks. I'm like, but it's literally what it was like. It was like all of those hormones and everything just came flooding back into my body. Right. And so then I was like, I feel like a teenage boy, because all I thought about was like sex for like 2 or 3 weeks. I was like, what's going on? I'm like, is it ever going to stop? Because it's becoming a problem. It was like so funny, but it was like, it was shut off for so long. Right. And then it came back, and the same thing is happening with her. And I was walking her through my experience, because I had just obviously gone through that myself. But it's kind of fascinating how that happens. And what's really even more interesting is like being in functional medicine, I measure my hormones, especially perimenopausally. fairly frequently. It depends, like somewhere in the ballpark of every 3 to 6 months to see what's going on. And my hormones all improved, and they had not, even though I was doing bioidentical hormone replacement. So it was super interesting to see all of these changes. So it's like really breaking through with that trauma can cause major, major shifts. And I was not obviously very cognizant of that until it happened for myself, right? So interesting with all of that. So do you ever see things like that happen in your work?
To see like those hormonal changes or like that shift in libido?
Well, to see that kind of like once women work through, whatever it is, whatever like, that trauma or that stuckness or that issue is, do you see them? Do they report back to you like significant shifts and changes?
Yeah, I would say that, when we're talking about a pelvic pain issue that's, in the hips or maybe it's in the low back, right? After working through some of that trauma, I know that there has been a definite shift and a change with those reports, whether it's like my low back pain is completely gone, or I don't even know what that feels like. I feel like a new person, or like my hips are floating. Like I just feel like I'm walking on air. It's just that heaviness is gone. When it comes to, that internal pelvic pain or pain with sex, once we, work through that trauma, I find, the goal is that they don't have pain with sex, right? But the ultimate goal is let's get to the bottom of why we're having pain with sex. And if it was a trauma-based reason, then yes, releasing that trauma absolutely improves their ability to engage with their partner, right? And be fully aroused. Whereas before they were just kind of going through the motions because, they had to, or
I can relate.
Yeah.
I think a lot of women
fully engaged.
I hear that a lot, right?
Yeah. Just being fully engaged. But yeah.
So interesting. Yeah. So when women are in that situation in your practice, is breath work one of the first things that you're using to help facilitate like the movement of the, trauma, stuckness, all of that? What else?
Absolutely. I feel like breath work is really the number one thing that I work on with clients, because a lot of, we just get stuck in our breath or we hold our breath. But sorry, what was go back to your question again. So I think I'm not answering the question.
Oh,
right.
No, it was basically, I was going to ask you. Yeah. So you've talked a lot about breath work. What are the next, after the breath work, what are the next things that you're, addressing to have people kind of move through this?
Yeah. So once we get breath work on cue, then we start working more on sometimes graded exposure to, whether it's just learning how to experience touch differently, right? So if you're, when your partner would touch you, that would, get that fight or flight response and just get that visceral response, right? Then we start working on, okay, can you hold hands with your partner? Okay. Can they put their hand on your leg? It's not a sexual experience. It is just an intimacy thing, right? Where we're just trying to be close with our partner or even close with ourselves. Like, can you put your own hand on your abdomen and be okay with it? Can you put your hand on your vulva and be okay with it? Because how many women don't and feel like that's dirty or that's something that I should be ashamed of, or who's watching me right now, because they just are so ingrained that that's not okay for their body. Whereas, we should know what our bodies look like. Men, they know what every inch of their body is like, right? They know all of that. But women, if they've never looked at their vulva, they have no idea, is there a color difference? Is there a texture difference? Is there, how is the hair looking down there? Is there hair down there? What is the sensitivity like? Can I put my hand on my abdomen and does that feel the same as putting my hand on my inner thigh? Right. So just feeling what is that felt sense? We talk about interoception, but what is that felt sense in your body with you just having a hand on yourself, right? Let alone having your partner touch you or a child. Sometimes it's a child coming and you're like, I don't want to be touched right now because you're stuck in that fight or flight response so long that everything is overstimulating. So anyway, going back to that graded exposure and just kind of seeing, okay, what does this feel like? And if it is a sensitivity issue, or we want to do some desensitization, right? So we're looking at textures, we're looking at different kinds of clothing. So sometimes it is maybe the jeans that you're wearing are just too tight and you need to go to a larger size, even though we all hate the larger size, right? But being comfortable in our clothing, right? And being comfortable, we need to be comfortable in our bodies. I don't care if you're a size 2 or a size 20. You need to be comfortable enough to be present in your body and not feel shameful. This is your body. This is, this glorious, beautiful thing. And if you have carried babies, then your body has, carried however many babies you've carried and done glorious things. And so you need to appreciate and respect that and get back to that, right? Get back to you and feel like you again, to where, we go through the motions as women of taking care of our kids, taking care of the pets, taking care of our husbands, taking care of the households. And if we work outside the home, when do we spend that time getting back to ourselves? I'm totally going off on a rabbit hole because that's what I do. But just that graded exposure.
That's what you're saying all the same stuff I say, right? Yeah.
Right. And then we move through, but just moving, like what I was getting to is just moving, feeling comfortable to move in your body. And what does it feel like to move in your body? Whether you're laying down on the floor and you're, reaching an arm up overhead and like bringing your leg out to the side and just opening things up, or whether you're crossing things over the body, whether you're in a child's pose and you're doing like a thread the needle where you're coming through the body and seeing, what does that feel like? Can I get that movement through my body? And still finding, where am I stuck? And kind of going to those stuck areas. I have some women who are so stuck in their rib cage, they have no rotation or barely any rotation. Why? What are they hanging on to? And working through that. And so it's kind of a step by step, but it's not a cookie cutter step by step. It's a very individualized step by step, and seeing, okay, so we've worked through the hip stuff. What's going on in the abdomen, or what's going on in the pelvic floor, or what's going on in your feet? I'm one of those people who I don't love feet. I became an OT because I don't love feet. So I didn't want to go to PT school, but I'm looking at feet so much because there's so much that happens in the feet that's affecting our pelvic floor. There's so much that is happening when we're walking, when we're standing, even when we're sitting, because our posture, has gotten so changed with, holding on to things in our feet that it's affecting all the way up the chain into the pelvis. And so just looking at, that's why I love to look at the whole body and not just your pelvic or your pelvis or the pelvic floor, because it could be your feet that might be the problem. It could be your breath that might be the problem. It could be your rib cage that's not moving, or maybe you're stuck wide after giving birth. And that's why we're getting too much pressure downward, because the rib cage is not expanding and coming back in the way it's supposed to. It's staying out here and you're breathing out through your belly instead of getting the diaphragm to be moving that rib cage. And so it's just looking at those different pieces of the puzzle. But going back to your original question about I kind of did, but going through that step-by-step process, again, it's not a cookie cutter thing. It's very individualized for clients. And you have to take a look at, okay, so they responded well to this piece of it, but this one they're really stuck in and not doing, or they got great movement in the hips now, but now they forgot how to breathe again and having to kind of go back. It's not a regression per se, but it is going back and looking at, okay, so now you've got the hips moving. Let's get the breath moving with the hips. Right. And so just trying to get all those pieces, like they know how to do it, but they've forgotten, because they're moving better down in the hip area, they've forgotten how to get the rib cage to move with the hips.
Yeah, it's interesting. Yeah, you brought up a lot of really important points. And it's like, I feel like if you're doing body work of any kind on any human being, you really need to be looking, like you mentioned, from feet to head. It's not like we're not like individual segments, and the feet are so like key. So yeah, I mean, anyone who has anything going on in the knees or the hips or even the back or shoulders, you still got to look at the feet. Yeah. That's a really, really important piece of it, because we're connected, like especially the fascial connection. I feel like that's interesting, because I find that the fascial piece changes a lot, especially for women after giving birth and with trauma. I do find that women who have more trauma tend to have more tight fascia. And I can say I experienced that myself too, because I used to be super duper duper flexible. And then I got really tight and I'm like, what's going on? And now I can see it starting to come out again. It's starting to relax more. That's super interesting. So there's lots of things to get in there. But one of the big things that I find, like you had mentioned, like exposure, like especially at the women birth, the process of childbirth causes so many changes, not just on a physical level, physiological level, but on an emotional and subconscious level too. And one thing that I see is like women have this shift from like I was, a woman part, like a couple that was a life transition. An individual person, but then they have these babies. And of course, we're all so connected to our babies and our children. And that's like, you become mom and you forget who you are. And there's like, I feel like inherently there's almost a loss of trust. And so some of it is trusting yourself, again, trust with your own body, then trust with your partner, right? And getting that intimacy back sometimes can be very, very difficult. I can say like with my first birth that I felt like that. Second one, because I had been through it, I was cognizant of it. But the first one, I was like, oh, I don't know if I can have sex again because I'm a mom, right? You know, it's like that type of stuff. I find that
so often.
Right. Yep. And so it is, it's like, and part of me was scared. I was like, I don't know if I want any penis coming near vagina, right? Because I was like, oh, I just went through some trauma. You know, there's so many things that happen. It's like, and we don't talk about this. We don't talk about this stuff enough. And it's really interesting because I also find that there often is, like when I'm doing the trauma and emotional work with people, there is like a lot of it is rooted in that I'm not safe. There's either like abandonment and or safety issues and trust issues. So it's like kind of unpacking all of those layers on top of everything too. It's something that...
Well, then you add guilt to that as well, right?
The guilt. Yeah. The guilt part too. Yeah. There's so many things. And it's really interesting because I feel like we, especially in the world that we live in, where information is so readily available and fast paced, we try to like condense everything down into like a little nugget. And you can't, because this topic especially is so multifaceted, because you have the subconscious and the emotional that manifests in the physical. You know, and there's so many layers to all of it. And I don't think that we honor that enough, right? It's like there's so much that needs to be unpacked and dealt with. And women just need to be supported during this. You know, there's learning, but then there's unlearning too. There's the unlearning piece of, like we talked, right? The shame, all of the programming that women have gotten throughout their lives about their bodies and how they should be and who they should be. There's so much, unlearning and deprogramming of that so that they can step into themselves, right? And express themselves fully and be their authentic selves and really just get to know themselves and love themselves again, because that's something else that I find. It's like women become disconnected, right? They become disconnected physically because you can see that. I mean, I see that happen a lot when I'm doing the emotional work, even virtually, but especially like when I'm in the presence of somebody, it's like you can see that where they kind of disconnect. And then when that happens, I do certain things to like ground them back in and make them feel safer in their bodies. But it's like so much of it is like working through all of that and just honoring who we are and allowing women to, just reclaim themselves, which I think is huge. That's kind of one of my major missions. I'm like, I just want women to feel safe and happy again and love themselves and just feel good in life instead of just, going through the motions, like you had mentioned, because going through the motions, I think, is something that a lot of women do.
Right. And just taking care of themselves. I find that even getting clients in my office, how many providers have they seen before they came in here? Or how many people have they talked to try to figure out what's going on in their body before I see them? Because there's just so much, like, oh, you can have surgery for this, or you can take a pill for this, or, this is just, you're going to have to live with it. This is just your life because you've had a baby. And I'm like, no. Why? Why are they telling you that? I had a client come in who, it was her second child, and I can't remember if it was the MA that was in with her, or the nurse practitioner, but basically told her, you might have to have a hysterectomy because you have this bladder prolapse. And she came to my office and I'm looking at her and I'm like, you're, 7 weeks postpartum. This is very typical. I said, there's some things that, you might still have a prolapse, but it's not a life sentence. You don't have to have surgery. She was told she had to have a hysterectomy. And I'm like, no, why? Why were they saying that to you? Is there, right. And so she just, as soon as she just talked through things with me and just, got a little bit more education on what is a prolapse and what does this truly mean? You could just see the tension just fall off her body because she was just carrying so much tension, and she's trying to breastfeed and she's trying to do all these things. And she's just holding on to this trauma that she experienced in the doctor's office, right? So it's not just, your body that's I don't want to say betraying you, but just like it's the outside sources coming in that also can be attacking you in a way that is maybe not accurate. And this is a medical professional telling you this. And, of course you're going to go home and like Google all the things and, do the freak out thing. And, it was just, to me, felt like your doctor's office did you a disservice by saying that to you. It'd be more, it'd be more proper. I would have said, okay, you have this bladder prolapse. These are some of the things that we see. And maybe hysterectomy is one of those things, but not to say you need one because you have this at, it was her 6-week visit at that time. No, like that's crazy.
Yeah. I think the point that I have experienced this myself, actually, it was yesterday. Like when I was I was talking to it was a colleague she's a nurse practitioner. She does integrative medicine. So she's kind of like one foot in both lands. And when I told her about the trauma piece and how I feel so much better and I feel like my hormones got better, even though, cause like we had been working on my hormones for like 2 years and nothing changed, but this is what changed them. She was like, she couldn't even fathom it. I had to tell her 3 times that it was all after, all of this trauma work and the release and all of that. And she's like, and then after I explained myself 3 times. She's like, are you having any vaginal dryness? I'm like, did you just hear me? I was like, no, I didn't. I'm like, there needs to be so much more, I feel like, education across the board on, I get, the mind body piece of it, the emotional, piece of it. Also just telling people, like, I'm always very careful when I talk to somebody about what's going on. Even if I think something's major, I lay out all of the options, right? And I usually go from like the most, kind of conservative or, least, impactful to the biggest one last. And I don't usually emphasize it because 99% of the time, it's not that big thing. And we don't have to go there, but there are other, little things that happen. And so, yeah, I wish that, they gave you training when you're in school to talk about things in these types of ways. They teach you diagnosis, they teach you how to treat, but the bedside manner and speaking to patients as human beings is lost so much. I think that, in our realm, you kind of intuitively learn it. And I think some of us are kind of born in that with that natural kind of nurturing, healing spirit. But it's so hard because I've had so many, like, same thing, especially postpartum women whose hormones are already, a mess and they're stressed out, right? They're stressed out because they just gave birth and they have this baby that's not sleeping and breastfeeding is often difficult and all of the things, right? And so you're putting more on them. It's ridiculous. And it makes me so frustrated. It's so like, you just want to help these people and you just want to educate the world and be like, you need to speak not just to postpartum women or women in general, but everybody, everybody should be given this courtesy of, laying everything out there, not just being like, hey, you need to have a hysterectomy because you have a prolapse. Well, yeah, a lot of women have prolapses after childbirth. It's a common thing. It's a very, very common thing. I mean, yeah. And that's prolapse. That's another subject in and of itself. The multiple kinds of prolapses you can have. And that I feel like a lot of people it's something you learn in school. And unless you're seeing it in practice, it's not something that I feel like you're very cognizant of, or you might be able to explain it, but you're explaining it, out of a textbook. You're not really explaining from experience, right? So it's one of those things that there can be some issues, with just the situation in and of itself. So last thing I wanted to ask you was if you had any experience yourself, any kind of personal story with your own kind of pelvic floor or core issues or anything like that.
Yeah. Well, that's actually why I'm a pelvic floor therapist, is because of my own pelvic floor issues. And I was not finding the help that I needed through my doctor. And I saw a physical therapist. And like I said, I think earlier in the podcast, she's like, do your Kegels and that's what you need to do. And I was finding this is not working in my body. This is actually making things worse. And I am just not feeling like myself. I'm an athlete. I come from, a background where I was doing sports multiple days a week, different sports, and was finding like, I can't even run across the room without feeling like I'm going to leak my pants. Right. And this is not okay. This is not normal. We go to a doctor and they say, oh, you had a baby. This is normal. It's not normal. It's very common, but it's not normal. And so I just decided, I'm an OT. I can figure this out, right? I'm going to figure this out. And so I did a deep dive and just started educating myself and started looking at all of the components in my life that were affecting my body. And I can't say that I'm, 100% free and clear because, you have different illnesses and things and you start to feel things in your body and things are a little bit different. But I've come from a place where I didn't want to run at all to a place where I can run after my kids and not even think about what's going on in my pelvic floor because I've got the control that I need. And so just finding a way to reach other women, to educate them. I love to do workshops. I love to teach and educate on the pelvic floor and just all the things to look for in your body and just how to feel things in your body because so many women don't feel things in their body or they just kind of shut it out. Like I'm just going to, I don't have time to take care of this right now. So I'm just going to deal with it. And then, they come see me 6 months later and we could have helped this problem months ago and you only needed a couple visits, right? And we could have done this months ago and think about how much better your quality of life would have been over those 6 months. Sometimes it's 6 years, so really just thinking about taking care of yourself. And I just found, just ways to take care of myself and decided, you know what, I'm going to make my career into helping women. And so I absolutely love to educate and help women. And yeah, that's just where I'm at. But it came from a place of just that personal experience where I did not feel like myself in my body. I felt like my body had betrayed me after birth. And my second and my third births were so much better because I knew better, right? Yeah. So just coming from that, I did have a really traumatic first birth, very long labor, very long pushing where I was, purple pushing and not doing great things for my pelvic floor. And so I do, I'm very upfront with my clients. So, this is where I came from and you don't have to experience that or, you come out with a prolapse. Okay. So I have a prolapse too. It's not a big deal if you know how to take care of it and manage it. And yes, there is a time and a place for surgery. So I'm not going to say that's never needed. But immediately postpartum surgery should, unless you are, having hemorrhaging or it's really affecting your body to where you can't function, surgery should not be the first thing that's brought to the table. That's just my opinion.
No, and I agree. Like I've had several patients who've gone through the prolapse situation and there are so many methods that you can use to address it. And only one of them had to have surgery. And if we worked on things for a good 9 months and she just it was not happening. It was not moving. It wasn't improving. She did all sorts of things. I mean, she was doing pelvic floor therapy and abdominal massage. She was doing all of the things, all of the right things, and it just wasn't happening. And so she ended up with surgery. So yeah, I agree. I'm like, for me, my brain always goes from, like I said before, like the most conservative methods to like the most extreme methods, let's exhaust all of our options first before we go having to go the surgical route, but sometimes we have to. It happens. It definitely happens. And it's okay. I think when I was younger, I used to be like very opposed to that stuff. And now I'm just like, yep, you got to do what you need to do. It's like you become much more, I think, forgiving to your body, like your body too. And it's funny because we talk about our bodies betraying us, but truthfully, our bodies are doing what it's supposed to do. If you are in a fight or flight situation or it's trauma, your body is going to tighten up to protect you. That's something I always talk to patients about is your body is doing what it's designed to do, even though it feels like it's wrong. It's not. It's really, it's helping you. It's protecting you. It's really a gift. And it's a gift because it's telling you that you need to do something. You need to change. There's something that you need to do to help support it better. And so that's why I was like, instead of looking at it as a betrayal, let's look at it as a gift. It's a little bit of a mind shift, but once you do that, I think it makes it easier, get perspective and to start that healing process. So you had so many good points, but I feel like some of the biggest takeaways, just to summarize for people, breath work, breath work is huge. And that's something that I talk about. I do it with patients, especially mostly when we're doing the trauma work, or it's sometimes when we're in functional medicine visits, but a lot of times when we're doing the trauma work, we are working with breath. That's what we start off with and all of the sessions. So it's really interesting that breath work is huge and breathing properly. I did an episode with one of my friends who is like a master with breath work, and he, walked people through, what proper breathing looks like, because people don't even do that. So that's, point number one, ladies, is breathing. Make sure you're breathing properly, and you can use your breath to help with all of these, issues. Another, I think, big point is pelvic floor. It's kind of a lifelong thing. It's like once you go through, menarche, it's your first period. But even before that, when the hormone changes start, that's when all of this stuff starts to shift and the hormones shift, and it sets the stage. And a lot of young girls are active. So it's not something that is just like a pregnancy and postpartum or even menopausal issue. It literally is a lifelong issue that we need to be aware of. And the third thing that you said that really stood out to me, which I thought was interesting, because I've thought this, but I don't think I've ever said it out loud to patients, but you can be tight and weak at the same time. And I think that is something that's probably lost on many people. You don't need to be doing more Kegels to like strengthen, those muscles. You need to be able to relax those muscles, right? So those are kind of like the big three takeaways that I, got. I mean, among the many, many, many other things that you said, because you had so many gems, and I really, really appreciate that. And just, again, so excited that we got to do this, and so grateful that you were here today.
Thank you so much. This was great.
Yes, it was awesome.
Appreciate you.
We'll have to dive into some of the other topics that we touched on. That could be topics for another day. There are several that we could elaborate on.
Yes, I like to go down those rabbit holes.
Me too. I'm a big jumper into the rabbit holes. Well, thanks again, Aleta. I really, really appreciate you. And I wanted to, if patients or anyone in the public wants to find you, where can they find you?
Yeah. So I don't have an official website. I think you have my landing page, which gives a lot of information about what I do and kind of how to get in contact with me. So I am Mountain Mama Pelvic Health, and you can find me on Google. I am in Monument, Colorado. So if you're local in Colorado Springs, Monument, Castle Rock area, I am happy to be a part of your journey.
Yeah. And what about social media? Where can they find you?
Yeah. So I have an Instagram, which is Mountain Mama Pelvic Health.
Okay. Perfect. Yeah. I just want to make sure everyone can find you. And of course, those links will always be in the show notes. And like she said, we are both in Monument, Colorado. So if you are looking for this kind of support, I would say even like the Denver metro, like the south part of the Denver metro, all the way into Colorado Springs. It's not that hard to get here. She is absolutely amazing.
Thank you.
Thank you. You're so welcome. And thank you so much for being here. If you made it this far, I truly appreciate you. Remember, knowledge is just the beginning. Taking action is what truly sparks change. If you're overwhelmed and don't have enough energy to make it through the day, I invite you to book a free 20-minute coaching call with me. It's a no-obligation chat where we can discuss your health goals and how I might be able to help you achieve them. Visit the link in the episode description to book that call. Until next time, keep striving for wellness, and remember, you have the power to not just survive, but thrive in motherhood.